Welcome to Introduction to Anatomical Nomenclature. In this presentation, you will learn the anatomical terms you will be using during your courses. Anatomical position or standard anatomical positions refers to the positioning of the body when it is standing upright and facing forward, with each arm hanging on either side of the body and the palms facing forward. The legs are parallel with feet flat on the floor and facing forward. It is used to provide a clear and consistent mechanism for describing the location of structures. The anatomical position allows healthcare providers to communicate consistently and give the proper orientation when dealing with patients. The figure on the right shows its anterior and posterior views. Four major planes of reference help describe the location of the structures. The median sagittal plane is a vertical plane that passes down the body's midline, separating it into equal halves. The parasagittal plane is a vertical plane that runs parallel to the median sagittal plane, which passes through the body longitudinally. It divides the body into a left section and a right section. The coronal or frontal plane, a vertical plane running from side to side that divides the body or any of its parts into anterior and posterior portions. It is also passes through the body longitudinally but perpendicular to the sagittal plane. Transverse or axial plane. This plane is horizontal and it is perpendicular to the sagittal and coronal planes and parallel to the ground. It divides the body into upper, superior, or lower, inferior sections. This figure shows the anatomical planes of reference from a superior view of the body. Anatomical terms of comparison and relationships. On the left, from a lateral view, you can see the anterior or ventral and the posterior or dorsal views of the body. On the right side, anterior view. On the upper and lower limbs, the following terms are used. Proximal means closer to the body's trunk or the point of origin of a part. For example, the proximal end of the femur joins with the pelvic bone. Distal means away from or farthest from the trunk or the point of origin of a part. For example, the hand is located at the distal end of the forearm. Medial means towards the body's midline. For example, the middle toe is located at the medial side of the foot. Lateral means away from the body's midline. For example, the little toe is located at the lateral side of the foot. The following terms refer to the vertical axis. Superior or cranial, towards the head end of the body, upper. For example, the hand is the part of the superior extremity. Inferior or caudal, away from the head end of the body, lower. For example, the foot is part of the inferior extremity. Anatomical terms of movement. Abduction, adduction, and rotation. Abduction and adduction occur within the coronal plane and involve medial lateral motions of the limbs, fingers, toes, or thumb. Abduction moves the limb laterally away from the body's midline, while adduction is the opposite movement that brings the limb towards the body or across the midline. Medial and lateral rotation. Medial and lateral rotation of the upper limb at the shoulder or lower limb at the hip involve turning the anterior surface of the limb toward the midline of the body, medial or internal rotation, or away from the midline, lateral or external rotation. Flexion and extension occur within the sagittal plane and involve anterior or posterior movement of the body or limbs. In the limbs, flexion decreases the angle between the bones, bending of the joint, while extension increases the angle and straightens the joint. Hyperextension means that there has been an excessive movement on a joint in one direction. In other words, the joint has been forced to move beyond its normal range of motion. Cervical flexion, bending the head forward towards the chest. Cervical extension, bending the head backward with the face toward the sky. Elevation and depression are upward or downward movements. Elevation refers to movement in a superior direction. Depression refers to movement in an inferior direction, the opposite of elevation. In this case, the upward movement of the scapula and shoulder is elevation, while downward movement is depression. These movements are used to shrug the shoulders. Protrusion and retrusion. Protrusion involves a movement going straight ahead or forward. Retrusion is the opposite and involves going backward. The tongue, chin, mandible, and lips are anatomical structure capable of such actions. Dorsiflexion and plantar flexion are terms used to describe movements at the ankle. They refer to the two surfaces of the foot, the superior surface called the dorsum and the plantar surface called the sole. Dorsiflexion occurs when the ankle bends, raising the toes upward and decreasing the angle between the dorsal side of the foot and the tibia. Plantar flexion occurs when the ankle bends in the direction that points the toes and plantar sides of the foot downward. The only movements permitted in the interphalangeal joints are flexion and extension. You can also see the normal flexion and extension movements of the metacarpophalangeal joint here. Abduction and adduction movements occur within the coronal plane and involve medial lateral movements of the limbs, fingers, toes, or thumb. Abduction moves the limb laterally away from the midline of the body. Adduction is the opposite movement that brings the limb toward the body or across the midline. Circumduction. In this case, it is the orderly combination of shoulder movement so that the hand traces a circle and the arm traces a cone. It is produced by shoulder flexion, abduction, extension, and adduction. Supination and pronation. Most often, this movement occurs with the hands in front of the body. Supination is turning the palm upward, and pronation is turning the palm downward. Surface terms for the hand and foot. The dorsum of the hand is the posterior side, and the palm is the anterior side. The dorsum of the foot is the anterior surface of the foot, and the sole is the plantar side of the foot. Movements unique to the feet. Inversion and eversion. These movements involve the rotation of the foot around its longitudinal axis, which runs from the heel to the toes. Inversion turns the sole inward towards the midline of the body. Eversion, opposite movement, turns the sole outward away from the midline. The foot can also do pronation and supination. Pronation is the inward rolling of the foot, while supination is the outward rolling. Different muscle shapes. We have flat, pennate, fusiform, quadrate, and circular muscle shapes. The human body has 640 muscles. Most are named based on their appearance, location, and attachment. We will see examples of muscles named by their shape, size, orientation of fibers, actions, number of attachment, points of attachment, and location. The deltoid muscle found in the shoulder is an excellent example of a muscle named by its triangular shape. Other examples are these two circular muscles that encircle two facial openings, orbicularis oculi and orbicularis oris muscles. The rhomboid muscles are also named by their rhombus or parallelogram shape. Platysma is the most superficial muscle in the neck and is named by its dimension. This name comes from the Greek word plateus, which means flat and wide. Another muscle named by its dimension is the serratus anterior muscle that is located in the thoracic cage. Serratus comes from the Latin word serrare, which means saw. Muscles are also named by their size. The Latin word vastus means great. The vastus muscle are a group of large muscles located in the anterior compartment of the thigh. The words major and minor can be used to compare the size of two muscles with the same name. For example, the pectoralis muscles. There is a pectoralis major and a pectoralis minor. Maximus means greatest and minimus means smallest. These are two Latin words that can be used to compare the size of muscles sharing the same name. For example, gluteus maximus and gluteus minimus. Since there is a gluteus medius, and medius means in the middle, we have gluteus maximus, medius, and minimus. On the hand, the Latin word minimi means small. The flexor digiti minimi is the muscle that flexes the small finger. Muscles named by their length. The Latin word longus means long, and brevis means short. These words are used in the name of muscles. Longissimus means longest. The longissimus is a muscle located in the back of the body. The orientation and location of the fibers in a muscle can determine its entire name. There are three types of fiber orientation: transverse, oblique, and rectus. Transverse fibers run perpendicular to the midline. The Latin word transversus means transverse, from side to side. Two examples here: transversus abdominis muscle, transverse muscle of the tongue. Oblique muscle fibers run diagonally or at an angle. Two examples are the external and internal abdominal oblique muscles. A muscle is called rectus when its fibers run parallel to the midline, as in the rectus abdominis muscle, or in a linear fashion, as in the superior rectus muscle. Muscles can also be named by their actions. In the upper and lower limbs, we find flexor and extensor muscles. Hallucis means big toe. One of the muscles that flexes the big toe is the flexor hallucis brevis. In the posterior compartment of the forearm, there is a muscle that extends the little finger. This muscle is named extensor digiti minimi. Two other actions you already learned in these presentations are supination and pronation. In the posterior compartment of the forearm, a muscle called supinator supinates the forearm and makes the palm face upward. The muscle in the anterior compartment of the forearm that pronates the forearm and makes the palm face downward is called pronator teres. Other examples of muscles named by their actions. Risorius muscle. When contracted, it pulls the corner of the mouth upward. That's why it is also known as the smiling muscle. Adductor pollicis muscle. Pollicis means of the thumb. Pyloric sphincter muscle. Constrict the pyloric orifice of the stomach upon contraction. Muscles named by their number of heads or bellies. Biceps means two heads. The bicep brachii muscle is found in the anterior compartment of the arm. Tricep means three heads. The triceps brachii muscle is found in the posterior compartment of the arm. Quadricep means four heads. The quadriceps femoris muscle is found in the anterior compartment of the thigh. Muscles named by their attachments. Sternohyoid muscle. This muscle originates in the sternum and attaches in the inferior border of the hyoid bone. Muscles named by their location. Tibialis anterior muscle is the longest muscle in the anterior compartment of the leg. Infrahyoid muscles. It is a group of muscles located inferior to the hyoid bone. The scapular spine divides two areas in the posterior surface of the scapula. The supraspinous fossa, where the supraspinatus muscle is located, and the infraspinous fossa, where the infraspinatus muscle is located. Naming of vessels. Most of the vessels, arteries, or veins are named by the organ or structures they supply, or where they are located. The renal arteries supply the kidneys. Subclavian arteries or veins are below the clavicle. The nerves are named by their location or function. For example, the vagus nerve. The Latin word vagus means wandering. The vagus nerve is the cranial nerve 10. Sciatic nerve. Sciatic means relating to the hip. The sciatic nerve is the largest nerve in the body, running from the lower back down the back of each leg.